Every year, more than 70 million people receive opioids after surgery, and research shows that 1 in 15 will go on to long-term use of these medications, putting them at risk for abuse or addiction. Our next guest says that patients and their caregivers should be aware of alternatives to managing pain. And joining us now with an alternative to opioids post-surgery is Dr. Scott Sigmund. Good morning to you, doctor.
Good morning, Molly. Thanks for having me.
Absolutely. Thank you for joining us on this important topic. So let's talk about opioid use and why it's become such a growing problem in America.
Yeah, so as an orthopedic surgery, obviously I perform surgery on a routine basis, and surgery is painful. And as doctors, we want to get our patients through that surgical experience with the least amount of pain as possible. The gold standard has always been the use of opioids. The problem with opioids is that 1 out of 15 people that have exposure to opioids will go on to long-term use. And what this has done is really helped to fuel this opioid crisis that we see across our country. So really what we're trying to do is come up with alternatives if we can.
Let's talk about alternatives and as it relates to pain management. What are some of the other options?
So in my clinical practice, I use a relatively new medication called Exparel. So for example, if you go to the dentist, they numb up your mouth, they do a surgical procedure, and you get pain relief for a couple hours and then it hurts. Well, Exparel is similar. It's a long-acting form of numbing medication that we can put in at the time of the surgery that, believe it or not, can provide upwards of 2 to 3 days worth of significant pain relief. So for example, I do knee replacement surgery. I fully expect my patients after a total knee replacement to be walking down the hall in my hospital the very first day of their surgery. And believe it or not, they're actually stating that they have minimal pain while doing so. It really is quite remarkable.
Is that safe? Because I'm wondering if you're talking about not being able to feel the pain, because sometimes pain is a good cue to us that something's wrong.
Yeah, no, it's remarkably safe. We have not had any significant patient complications. If anything, we've had less compared to the alternatives that were available previously. Patients have full motor control, but they just don't have pain. They're assisted by physical therapists and nurses to make sure that they are very safe.
Is this widely available, this alternative that you're talking about? Do other doctors and surgeons know about it?
Yeah, it is widely available across our country, and I really think the take-home message that I'm trying to get today to our viewers is that you have a choice, and we want to empower our patients. We want to educate you that you can go to the doctor and ask what alternatives are available. Now, I get it, going to the doctor can be a scary experience, and you certainly don't want to interrupt the doctor's thoughts. You may not even know what questions to ask. There's a terrific website, patientdiscussionguide.com, that has a listing of questions that you can ask your doctor. You can print it right off, bring it with you to the doctor's office, and really talk to your doctor about what options are available. We want to empower you. We want to include you in the process. This is available.
Wonderful. So it's okay to ask your doctor is a really good message for people to hear, I think, to ask about alternatives, because overuse or addiction is a scary thing.
100%, Molly. Can't agree more.
And where should people go again for more information?
Sure, that's patientdiscussionguide.com. Please don't be afraid to talk to your doctor and ask for the alternatives that are available. We don't want any of you to be the 1 in 15 that goes on to this horrible opioid crisis.
Doctor, thank you for your time this morning. We appreciate it.
You as well. Have a good day.
You too.